Now to the H1N1 flu and startling new statistics that show what a threat it is to children. The latest report from the Centers for Disease Control says that H1N1 flu has killed 49 children in this country, and that number continues to rise. At least 19 kids have died in 14 states since the beginning of August, just as the traditional flu season is getting underway. One of the latest victims is this young lady, 14-year-old Chloe Lindsey, who died just this past Sunday. And this morning, joining us exclusively from Cisco, Texas, are Chloe's parents, Tom and Tammy Osborne. Tom, Tammy, right off the bat, I want you to know that our hearts go out to you. I'm so sorry for your loss. As a parent,
Thank you.
Oh, you're welcome. As a parent, we all hear these stories of H1N1, and we never imagine that it could happen to us and our kids. Why come on this morning? What message do you want to get out this morning, Tammy?
I think that the reason that we decided to do this and what we think it's most important for people to know, even in our time of pain, is that I knew that Chloe was sick. And even though the doctor said that she was going to be okay and they didn't give her the medicine, that I knew she was really sick. And I wish that I would have been more demanding in her treatment and been more of an advocate for her than I was. And I think that it's important for me to let people know that even though we're taught all of our lives to trust our doctors, and I do trust my doctor, that nobody knows my child better than me. And that when I knew that something wasn't right, I should have gone and made somebody do something.
If you could, Tom, take us through this. What were Chloe's initial symptoms, and at what point did you decide to call the doctor?
Well, on Wednesday, she came home. She was feeling flushed, and she had a temperature on Wednesday evening. On Thursday, when she got up, she still had fever, and her mom kept her home. And she called the doctor's office, and they told us to not bring her in because they didn't want to flood the waiting rooms with sick children that they could possibly, infect each other. And then so they said just keep her home, do fluids and rest, use Tylenol or ibuprofen to keep the fever down. On Friday, when she got up, it was worse. Much worse. And when Tammy called, they said bring her in. And she took her in, and they did the swab test, and it came back positive for type A flu, which H1N1 is a part of that family.
They started Tamiflu right then?
No, they did not, because what they said was that by CDC guidelines, that to prevent resistance from building up, that if a child was healthy and had no underlying health conditions, which Chloe did not, she was very healthy, that they were asking doctors to not prescribe the Tamiflu so as not to build up the resistance.
At what point did she finally take the Tamiflu?
When she was in the hospital on Sunday in critical condition because she couldn't breathe anymore because she had developed pneumonia. Because on Saturday she had started to breathe very shallowly, and her heart rate started to race, and we called the doctors, and we thought that perhaps she was dehydrated because her throat hurt so bad that she couldn't drink or eat anything. But it wasn't until she got to the hospital and they got her into the ICU that she started to receive the Tamiflu. But by that time it wasn't enough. Her little body couldn't find it anymore.
All right. Tom, Tammy, thank you so much for sharing your story and doing such a service in the middle of your horrible pain for every other parent in this country. Thank you.
Thank you. Thank you.
We believe that it's what Chloe would want. She always wanted to help others. She was always looking out for everybody else and not herself. So we felt that in her honor that we should try to help others so that maybe that they can avoid this.
Thank you. God bless you. Take care.
Thank you so much.
All right. We want to bring in our Dr. Jennifer Ashton this morning to help us figure out what we should take away from this horrible story. You heard Chloe's mom say that she wished she would have trusted her instincts, and even though the doctor told her not to come in when her daughter had a fever and she felt something was wrong, she should have done something differently.
Right. You know, Maggie, it's human nature in the setting of a tragedy like this to want to second guess, to say, what should I have done differently, to place blame, anger. That is all normal. It's normal for parents and it's normal for doctors. And I think what bears emphasis here is that when the CDC revised their guidelines for Tamiflu treatment, they did that in the setting of broad recommendations. It is always left up to the physician's clinical judgment to work either within or go outside of those guidelines and recommendations. And basically, they're for children under the age of 2, children with underlying medical conditions, children who need to be hospitalized or have severe cases of H1N1 or general influenza. And we need to remember that children, most of the time, they can get sick very quickly, but they also can recover very quickly. And we're always going to hear, unfortunately, tragic examples like this. But again, you know, it just bears remembering that this virus can behave in unpredictable fashion.
We know that Chloe's situation is not the norm, so would you just recommend to parents that they do trust their instincts? And even if the doctor's saying one thing, tell them, my gut is telling me this,
Absolutely.
doctor.
And people also, forget about just parents, people need to trust their own instincts. Right. No one knows yourself better than you, and no one knows your child better than you.
All right, Dr. Jennifer Ashton, thanks so much.